All right. Well, that's never happened before, but
Yeah, that's new.
all right. Hi, everyone. Thanks for joining us today. This is the Lyme Disease Awareness Health Series that we've been doing all month. And thank you for joining us today. I'm joined with Joe Bonacci, our acupuncturist and functional medicine practitioner. If you've been seeing some of these videos over the course of the month, we've been discussing all sorts of different things as it relates to Lyme disease. Started off the month discussing with Jenna Richardson, our clinical director and co-founder, how Lyme disease really kind of got her into integrative health practice herself. We talked about how prevalent it still is and how many people don't really know just how prevalent it still is, and how if missed or undiagnosed, it can really lead to long-term health effects that we may not even relate to Lyme disease. Then I also spoke with Regina, and she talked about a plant-based treatment as it relates to Lyme and how that can also help support us in treating those symptoms. Last week, Dr. Vin and I discussed how Lyme disease ultimately can affect our brain and cognitive function. And today, Joe and I are going to discuss an integrative approach, more in a general sense, and then we're also going to dig into how acupuncture can specifically help in treating Lyme disease. So again, thank you for joining us. Lyme disease, again, it's May. It's times where the bugs are coming out, and we really want to be cognizant of preventing and then protecting ourselves in the event of a Lyme tick bite. So Joe, thank you so much for joining us today.
Yeah, thanks for
And
having me.
can you give us just a brief overview about how an integrative approach to treating Lyme can be beneficial for us?
Yeah, generally, a lot of the approach that people initially get for Lyme disease is just the antibiotic approach. And a lot of times they're not getting it for as long as they should. And for a vast majority of people, that's actually not effective in terms of warding off Lyme disease. And then the Lyme can become dormant. And then it can kind of reveal itself later, especially like in moments when your immune system is weakened, or if you're in high stress times, it'll kind of take the opportunity to attack then.
Right.
So yeah, we've learned a lot through our Lyme mentorship with Dr. Thomas Moorcroft about the approaches in this. He has a very specific plan with Dr. Vinny. We all work together on this in terms of using antibiotics as well as using an herbal approach. And a lot of times, patients will react better to one type of approach or another, or a certain combination of the two. And so a lot of times with treating Lyme, that integrative approach is about seeing what works for patients. And a lot of it, in terms of the speciality of it, is also understanding how to bring people up onto these type of treatments without going too fast, so they don't get any type of negative detox reactions. That's really important. A lot of the herbs specifically that are like in alcohol tinctures, you build up over time with a few drops a day, and you add more. If there's any kind of negative reaction, you step back down. Basically, it's your body telling you how fast it can detox, and so they bring it up slow. So there's not too much of an influence on that in your system too fast. So yeah, we work a lot with patients in doing both of those treatments. And as the acupuncturist, I also do acupuncture for a lot of our Lyme patients. Yeah, and it's a really good approach because it's just another means of adding another anti-inflammatory approach to the treatment, and rounds out the treatment really well.
What are the most common symptoms that you see when a Lyme patient comes in?
Yeah, so Lyme patients typically have dealt with chronic pain in some way for a period of time. At least a lot of the ones that I end up treating for acupuncture, because that's really helpful for that. And a lot of times they've been through the ringer. They've been to a lot of orthopedists. They've been to a lot of PT sessions. They're doing stuff that's normally supposed to help their pain, but it's not reacting well. In fact, sometimes it inflames it, and they're trying to figure out like what's going on. And a lot of times they haven't really gotten the Lyme diagnosis by the time they got here. So honestly, a lot of the patients, they're dealing with the kind of typical multiple joint pain that can come and go from different areas, with swelling sometimes, or skin irritation that shows up. But also, if they've been through Lyme long enough, they're usually dealing with some kind of digestive issues occasionally. Like Dr. Vinny talked about brain health, there's a lot of brain fog. And then whether it's caused by the Lyme directly or not, there's a lot of anxiety and depression that kind of follows, because they've been through a lot of times, years of treatment that hasn't worked, and they're just kind of at their wits' end. And, that puts their nervous system in a certain place just by the time they get to us. But yeah, it can cause, any number of symptoms really. A lot of skin issues can come up, a lot of fatigue. just general malaise and inability to be active, or very commonly it's like I can do a certain amount of activity, but if I do what I really want to do, I get in pain or like I have symptoms, and that's really frustrating because they can kind of do an hour's worth of something they need to do 8 hours of, especially if it's like physical work, like they're a contractor or doing something that's actually laborious for them for manual labor. And that gets frustrating because they just can't do anything without causing a flare. And if their immune systems drop down enough and this process has happened enough, a lot of them end up on disability or they have trouble just even going to work at a certain point. And that's, unfortunately, a lot of ways that people end up at our door, because they've basically gone through that whole process and they're here now and they're like, how do I fix this? And sometimes they don't even know it's Lyme until we do the right test. Which again can be a part of the whole process, is getting the right lab to do the right test, because there's different labs that tend to have better efficiency or accuracy, precision with the testing. So it's part of the education also, is to just know which labs to use so you have a result you can trust.
Absolutely. That was kind of a great segue into my next question, because I know
Okay.
that a big difference for an integrative approach is the type of testing that we do, as opposed to a more traditional or standard, lab that you might see elsewhere.
Yeah.
What is the difference? And we have talked about this on some previous ones, but I'd love your perspective as well.
Yeah, I mean, the standard is an MDL, which can be accurate for some cases. We kind of use that as a screening tool sometimes because it's actually covered by insurance, so a lot of people want to use that.
Hmm.
But it's not the most trustworthy, especially when you get into other co-infections that you're looking for. IGeneX tends to be the lab that we like to use for Lyme. And a lot of that just comes from a lot of experience that we've heard from other practitioners as well as our own experience. We literally have, Dr. Tom Moorcroft, who's is our mentor for this. He's literally done the test of knowing he has a positive Lyme case and sending it to multiple labs,
Okay.
and then finding out other labs came back negative when it was actually positive. And he's done that with multiple co-infections. So while there's some cost out of pocket to get the right lab to do the test, it's a better test to do because you just know what you're dealing with at that point.
Absolutely. So if someone does come in and they end up with a positive test, what's the first, steps in treating that?
Yeah. So usually there is some kind of, depending on what the patient wants, in a certain way, where we start, because we know antibiotics can be effective. We know different varieties of antibiotics can be effective. We know different varieties of herbs can be effective. So a lot of times we'll have patients that are hesitant to take antibiotics, also possibly because the Lyme has affected their GI tract and they're getting digestive issues that are chronic. And so they're very concerned that taking an antibiotic is going to, do something worse to their gut microbiome. And of course, as functional medicine practitioners, we're always looking at that as well. So yeah, oftentimes, we may start with just herbal protocols at that point, to see how they're doing.
Yeah.
And basically see where that goes and how much benefit they're getting out of that. And then we may layer in antibiotics if necessary. And we're always doing that with probiotics in mind. And we can test and retest in terms of seeing how their gut microbiome is reacting and how we're benefiting it and how we're getting it back to normal, if there is any deficiency in that.
Yeah.
But yeah, usually it's just a matter of starting out with a place where they're comfortable or a place where we feel is the right place to start. And it's really, as Dr. Tom kind of says, treating Lyme is kind of like treating an animal. It's not like a normal thing where you just give it the right answer and it goes away. It's kind of like you have to poke it and see how it reacts, and then you have these tools that you know how they operate. And so when you give it to people, you expect a certain reaction over a certain time frame.
Yeah.
And that kind of protects you as a practitioner to understand how the patient should be reacting. If it's not working, you know how to switch and you know what to switch to, because there's different paths that you can take to approach it.
Right.
Yeah.
I think it's so important to highlight that too, because, we may be giving you a treatment for something that may cause an adverse reaction somewhere else in your body. So we're always keeping that in mind when, approaching a client and seeing the reactions that someone may be having. And
Yeah, and
that
there's
also,
a lot of the antibiotics we choose tend to be the ones that are more accurate in terms of not causing a grand scale change in the gut microbiome. We're trying to pick ones that really are detailed, in terms of not having that grand effect on your body. And then there's probiotics that we're very aware of that counter certain antibiotics. So we end up layering those in with treatment as well, along with a lot of our other gut health type of work we do.
yeah. Thank you so much for all that information. We did talk briefly about the acupuncture. Is there any more information specifically you want to give about how acupuncture can help with the treatment of Lyme disease?
Yeah, definitely. So as we kind of just discussed, a lot of people that are in chronic Lyme states have basically entered into a chronic stress state.
Hmm.
And really, that's a pretty terrible place to be in. Our sympathetic nervous system is supposed to have this kind of stress response that's supposed to happen when we need it in an acute way and then drop down. And we're supposed to return to our normal parasympathetic state where we're, resting and digesting and building our body up. The sympathetic state is more of a breakdown state and more of trying to utilize parts of the body to attack something. And that's why it's supposed to be a temporary state. It's not a good state for the body to be in all the time, but it's a good weapon that we have to fight disease. So oftentimes with chronic Lyme, what's happened is they've gone through that state and it's been unsuccessful. And then the Lyme is just continuing to attack them in cycles. And so basically they end in a sympathetic, dominant state, which is really awful because they're dealing with Lyme and now they have their immune system in a setting that it shouldn't be on to fight it. Your sympathetic setting is better for chronic disease overall, mainly because your parasympathetic nervous system is more judicious with how it does anti-inflammatory response. It won't break down as much tissue. It's more, picking specifically how it wants to react, like a cytokine reaction or what have you. So yeah, acupuncture automatically, as we kind of talked about this, has a relaxation response. So just that alone is really effective for patients in terms of getting them out of a kind of anxiety state, getting their body out of an inflammatory state, making them feel like they're not in a reactive state, which a lot of times people with Lyme are dealing with mentally and physically. Like I said, like they do something for 10 minutes, they're fine. They do it for a half hour and they're in trouble. And that's a tough spot for your mind to be in on a day-to-day basis for years, essentially. So acupuncture has that effect. Also, just on an immune response aspect, acupuncture is known to increase red blood cells, white blood cells, T cell response. So along the lines of your positive immune response, acupuncture promotes that. So while calming the nervous system, it's also boosting the immune system in a proper way to deal with chronic disease, which is a good benefit. It's kind of the side effect of getting treated for whatever you're coming in for. Also, specifically when you get into Lyme, you're dealing with a lot of neuropathy. So I didn't really discuss that initially. A lot of people are having like numbness and tingling. They're having nerve sensations that they shouldn't have. And again, like they come in and they're like, I got testing and they said that the nerve wasn't inflamed and that shouldn't be, that's not there. It's not causing that. Or I had one case actually where they tested him multiple times in the same week and he was inflamed one day and not inflamed the other. And it was clear that there was some other systemic response going on because his carpal tunnel shouldn't have reacted that way. Carpal tunnel state, the inflammation should have been there in the next 5 days later, same exact result. So yeah, you'll see a lot of these kind of come and go symptoms with neuropathy. And acupuncture can help restore the nerve function, can help calm the inflammation directly. I will caveat that in saying that you do need to be doing the internal work too. If you just do acupuncture, you can run into exactly what the PT and these other doctors are doing, where you're trying to treat it normally the orthopedic way, but they're having this Lyme response along with it. So it works in adjunct with herbal and antibiotics. You don't really want to do just acupuncture for Lyme. You always want to have an internal component going on because you need to treat the actual Lyme disease itself to calm that down. But essentially, as you're taking away the pathogen from the body that's causing the inflammation, the acupuncture can help heal the body faster on that return. So yeah, a lot of the nerve issues, people who have like sciatic pain, that's actually caused more from like a Lyme issue. And also just the joint pain itself. So interjoint needling with acupuncture just helps to promote that anti-inflammatory response locally in the joint. So if they're having issues in their wrist or their ankle or their knee, what have you, we can target those areas and help them more directly.
Yeah.
And it's great because acupuncture is mobile, right? So I like every different treatment. Sometimes they have it in a different spot. It's the Lyme is moving it around their body. So acupuncture with repeated sessions, you can just change what you're doing on the fly and be like, okay, it's more bothering your wrist today and your elbow, so we're going to focus on that. It's not like you have to just do one treatment the whole time and hope that it sits well with them, and it's a repetitive treatment generally as you're getting treatment, so it can adjust along the way with as much as your herbs and your antibiotics do.
Yeah, absolutely. Well, again, every time we have our discussions, I learn so much from you, Joe. So thank you so much. I mean, so many people, I think, have symptoms like this and just have no idea that it could be related to Lyme. So it's really important that if you are experiencing any of what Joe talked about, and, we've talked about this on several of the other Lyme workshops, that you maybe get tested for Lyme to just at least know, or to weed it out as a possible, culprit for why you're experiencing those symptoms. We do have some people on the Zoom and some viewers on Facebook, so I would love to open it up to questions if anyone has any. You can go ahead and unmute yourself or type a question in the chat. But I agree, again, thank you so much, Joe. And if you do have any questions that you'd want to talk privately about, we offer 30-minute free discovery sessions with our practitioners, so you can go over any challenges or questions that you might have. And our number is 609-512-1468 if you'd like to schedule that, or you can email us at info@princetonih.com. Is there anything else you'd want to add to our discussion as it relates to Lyme at this time? I don't see any questions, so.
Yeah, the only thing I'm just thinking of that I didn't say about the integrative approach is that the other thing that's important about seeing somebody who works in like a functional medicine integrative way with Lyme is usually, since Lyme's been going on for a while, it's caused other problems. Like we were talking about gut inflammation, that can be an issue, the leaky gut kind of presentation that comes along with it, the brain fog. And oftentimes when we test people, we're finding that they also have mold or candida or SIBO. Like there's another aspect that's happened, and that's in part happened because their body was weakened by the Lyme to begin with.
Right.
So what's really important about that is that, again, you run into people that got tested positive for SIBO but never were tested for Lyme, and they treated the SIBO and it just keeps coming back and keeps coming back, and it's because their body can't rectify what's going on because they're dealing with chronic inflammation from Lyme.
Yeah.
So a real big part about how we approach Lyme and testing is identifying all the factors and figuring out what layers to remove first. Whether we need to treat the mold first or the Lyme first, whether we need to treat the leaky gut. It's all about that order of operations.
Right.
And that's a big part because, again, a lot of people are only getting a piece of it and they're only trying to treat a piece of it. And that just tends not to be helpful with Lyme. It's too clever. Lyme can do too much to you, and it's got its different forms that it hides in, like biofilm and then spirochetes that come out. So, and again, that's another whole thing with the herbs and the antibiotics. It's basically figuring out what state the patient's likely in and how to get rid of the Lyme based on what state it's in. Because if you just give antibiotics and it's in a biofilm form, you may never the antibiotics may never even touch the Lyme because it's hiding, and it's got a nice coating on it that's keeping it from getting treated. So that's where the herbs are really important. A lot of the herbs are really addressing this biofilm aspect, this kind of cyst form where it's balling up and hiding. A lot of those herbs will break down those type of biofilms, and then the antibiotic itself can actually be effective. So even people who have been treated with the normal 2 weeks antibiotics, they may even actually be able to benefit from that. They just didn't get the herbal side to basically allow those antibiotics to work.
Right.
So yeah, that's the only thing I can think of that I mentioned in the integrated part.
And I know we have some people that joined on Facebook a little bit later, so I wanted to just let everyone know, if you missed part of this presentation, you can always find our videos saved on our Facebook page. I also put them up on our YouTube page, so if you go there, you can just search Princeton Integrative Health, and we've got tons of playlists from the Lyme Disease Awareness Month series. We have Stress Month Awareness. We have our Dr. Vin Health series. We did a whole series on women's health, so check out our YouTube page. We have tons of videos there with so much great information. And yeah, as far as Lyme disease goes, it's May. We are heading into summer. Please be very aware and just protect yourself against Lyme tick bites at all costs. If you are experiencing any of the symptoms that Joe spoke about, again, please come in and get checked out so we can help you and treat you and heal you.
Yeah. We also have some preventative treatments. If you do have a tick bite and you're concerned that it might result in Lyme, but you're not sure if it's going to, there's certain protocols that we recommend to start right from there. So you don't have to wait for Lyme diagnosis necessarily. You can be preventative from keeping it from getting into your system and staying there.
So
yeah,
that is the key, really.
Yeah.
All right. Well, thank you all again for joining us. Thank you, Joe, for so much great information. Next month, we're going to be talking a lot about it's actually Brain Health and Alzheimer's Awareness Month, so we'll be talking about that and some other great topics as it relates to our brain, like PTSD and vision and all of that. So please keep yourself updated on our Facebook page, because we will announce those dates as they are put down on the calendar.
Thanks, Krista.
Thanks a lot, Joe. Have a great day, everyone.
Thank you.
Bye.